Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician, and I manage people with weight problem. And I get asked this particular question whether they should continue with alcohol consumption. It's quite common in the UK. An answer is not straightforward. Okay, I'm going to discuss why you should significantly cut down alcohol intake when you're on weight loss injections like Wegovy or Mounjaro. Okay, the first thing is alcohol reduces your blood sugar, you know that. And similarly, Wegovy does also. So you may have a very low blood sugar, which is not a good thing. And you may feel dizzy and you may feel unwell. So it's very important to remember to significantly cut down your alcohol intake. The second factor is alcohol in excess can also cause nausea, vomiting, heartburn, indigestion, which is exactly the same as these injections. The side effects can be nausea, vomiting, heartburn, constipation, diarrhea, indigestion. So you can get confused whether it's due to alcohol or it's due to these injections. So it's better to significantly cut down alcohol intake. The third and the serious one is alcohol can predispose people to pancreatitis or inflammation of the pancreas. And as you know, pancreatitis is one of the rare side effects of Wegovy and Ozempic and Mounjaro, 𝒘𝒊𝒕𝒉. So it's better to reduce alcohol intake significantly. Now, one of the reasons I ask my patients to reduce alcohol intake is alcohol reduces your inhibition. That is, when you get inebriated or you take lots of alcohol, you lose control of yourself in your actions, in your thought process, in how much food you eat, the quantity of food, your hunger is disturbed, and in fact, it may be counterproductive to your weight loss journey. So this is another reason why I ask my patients to reduce alcohol intake. That's a fifth reason is it interacts with medications. If you're on any other medication, it does interact with medication, which can be harmful to you. And especially if you've got diabetes, again, it can be harmful. So I advise my patients to be cautious with the amount of alcohol they consume. And the last of the reasons is the whole purpose of weight management is defeated because alcohol is calories. If you consume lots of alcohol, you're consuming lots of calories. There's no point cutting down your food intake and consuming a lot of alcohol. So these are the 6 reasons why you should not consume significant amount of alcohol. I usually recommend my patients to have less than 14 or 12 units per week. In fact, it should be much less than that, especially if you're planning to lose weight. Now, I'll tell you my experience of my patients telling me that most of my patients come and tell me, "Doctor, I cannot drink the amount of alcohol I used to drink before since I've been on injection Wegovy." And what they tell me is they're more sensitive. The buzz they were getting with alcohol, they're not getting, and they're losing interest. That may be because the area of the brain which gives you the buzz with eating food is also closely related to the area where alcohol affects your brain. So they're all closely related. So this may be one of the reasons why people either lose interest or the desired effect of alcohol is not there. So they've started to cut down. A lot of my patients have significantly cut down alcohol intake. In fact, they don't derive the same amount of pleasure. So my advice is, please see if you can cut down alcohol intake, especially when you're on Ozempic, Wegovy, or even Mounjaro.